Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, welcome back to Healing Families Shattered by Addiction. I'm Di McQueen, and today I'm joined by my good friend and partner, Dr. Brian Jackson. Hey B, how are you?
Hey, good afternoon, Di. Good to see you.
Good to see you as well. Always love doing these with you. We're back doing our podcast, Healing Families Shattered by Addiction, and today we have a really interesting topic, one I think that is probably at the root cause of a lot of people, some confusion, some discomfort, some, like how does this relate back to families as well as the addict? And today we wanted to talk a little bit about the big word of shame. And that's a big 5-letter word in our book, and it's one that causes a lot of people to go prickly. Would you agree?
Yes, absolutely, absolutely. Shame does not feel good.
It does not. So for us, we really hear a lot of times about what we call the guilt shame cycle in the world of addiction. And it's really, where we transpose that feeling of guilt, which can be very healthy, and maybe not so healthy, depending on, and that's a behavioral thing, which is sort of a motivator at times in a good and or bad way. But when it moves into shame, that kind of changes everything. It goes from something that is behavioral to a defining statement, and defining usually in not such a good way. So I have done something wrong to I am wrong. And for most of us, when you're talking about the addict, we always go like, we know that. That's what continues to put people back in the cycle of drinking, drugging, etc. Because when I feel shame or I am shame, I don't want that feeling anymore. But how does that relate into the family itself, right? And we know that the family of addicts also feel very much that guilt shame cycle. So we wanted to talk a little bit about just what exactly is shame. Shame is, it's very painful for most of us. It's not a good feeling. Let's just put it that way. It's so much so that it is an emotion that all of us at some point in our lives feel, which, we don't want to have people stuck in shame, but we also know that it's important that everybody feels some shame. Otherwise, we're sociopaths. And so we don't want that either. But we do know that everybody at some point has, some shame in their lives. Most of us have a physiological response to that. When we feel shame, we're embarrassed, we turn red, we get, sweaty, we freeze, we don't know exactly what's going on, we avoid eye contact. We do all those things that, we might get dizzy, nauseous, whatever. That's that physiological response. It's powerful, it's a driving force for a lot of us where we go like, oh my goodness, this is something that we learned in childhood. Most of us definitely got that, I'm so ashamed of you from our parents, right? But what happens between the addict behavior and then moving into the family behavior? And, how does it relate in a family? So most of us don't really realize that, yes, the addict may be acting out and stuff, but how does the family member respond to that? And how do they feel that guilt shame cycle and the shame that they feel? Because oftentimes they believe that they're the reasons why someone is doing this. And they can't understand why this person would act out on them over and over again. And the shame that starts to well inside of them and the feelings of like, I don't understand. I don't know why they're doing this to me. Why or what have I done to them to cause them to act this way? And, I don't get it. I don't understand. I must be doing something. If only I could. And, they've embarrassed me in public. I'm so ashamed of their behavior. I'm so ashamed of myself that I can't understand why I've done something to them. B, what do you think about all of this, in the guilt shame cycle and the way that it acts and reacts to an addict and then the family member? And we get into this big old loop, right, of shame.
Yeah, I mean, for an addict and as somebody who's in recovery, the guilt and the shame, intellectually we know when we're using and we're not trying to stop, there is a lot of shame and a lot of guilt associated with what's going on with us, which leads to more and more use. And it's interesting when people come into recovery and people that we've met with, and they get sober and they get lucid, they have a really, really difficult time letting go of the guilt and the shame. And I always like to talk about shame as, shame says I made a mistake, but toxic shame says I am a mistake. And so the self-talk becomes, I'm useless, I'm worthless. And so we try and table it as the reality of the whole thing is that you made a mistake. And some of those mistakes have nothing to do with substance use disorder or acting out with substances and alcohol. It's some of the behavior that you engaged in while you were under the influence. And so it's so important to forgive yourself. But a lot of translations to families and families we work with is they have a lot of guilt associated with why their son, their daughter, their spouse is struggling with this illness. And a lot of times they keep it to themselves and, they're not telling their neighbor. Like, for example, if your loved one had diabetes, you wouldn't hesitate to talk to a neighbor about that. And so there's a lot of holding on, guilt associated with the fact that a family member is suffering from the illness. And do I have a part in that? Do I play a role in that? And then there's shame. Oh my God, I have a family member who's abusing alcohol or abusing chemicals. And so that becomes a toxic shame too, because you're keeping it inside. You're not talking to anybody about it. You don't feel comfortable talking to your relatives about it, to your close friends about it. And that's why it's so, so important to be able to be in a place where somebody can be empathetic and understand that is a third party that has done this for a long time, i.e. like myself, and die. Because once you start to be able to express how you feel and what is going on with you and get some education and some suggestions as to how to handle these situations, the amount of relief that I see on family members' faces, just like on the addicts' faces, as they start to realize that this is a disease that affects the whole family. Nobody should feel guilty. Nobody should feel shame. How do we get from that place to a place of being healthy and realizing, okay, this is an illness and we're going to try and work on this as a family, and be as supportive of each other as we possibly can. And in some cases, you might have to do some different things.
Right. So, I mean, Brian, leading into that is the shame that leads us into codependency, right? Which is the family. And with those is those symptoms of shame that we understand from codependency, the perfectionism, and that turns into a whole, the low self-esteem, the people pleasing, the guilt, right? So the shame then leads to, from those we start that whole controlling behavior, the caretaking, the dysfunctional, the non-assertive communication, and that sends another spiral, right? Which then takes us to another level, that the family starts to take over, trying to control that addict, right? So we then our behaviors, we have our own addictive behaviors of that codependent nature. And so now we have our own shame associated with that, trying to figure out what's going on with them. And then the addict is, not understanding what's happening. And we start this whole wheel of dysfunction that begins to spiral out of control, as Bri had been saying, and the shame then creates the fear and the anxiety around the relationship, making it very difficult for anybody to be able to talk. There's no intimacy anymore because one's sabotaging the other, because nobody's, quieting down, pulling back from being able to. And there's just one thing after there's layering upon layering upon layering. And it's getting worse and worse and worse until someone is willing to take the position to pull away, to get some tools in their toolbox on how to step away from the dysfunctional behavior of the codependent shame, addiction, guilt cycle that we've been dealing with, right? So, yeah, I mean, I think B, you were talking a little bit about some of the tools that you might be able to put into that, that might be helpful, in ways to think about how we can, better help one another. That might be useful.
Yeah. So again, back to, healing shame is what we want to do. And how do we heal shame? And I spoke earlier about, overcoming shame and the codependency that I was just talking about, really requires a safe environment where you can be vulnerable and you can express yourself, and receive acceptance and empathy. And you're not going to get that within the family system as you continue to cycle through the guilt and the shame and the codependency. So, we want to get you to a point where then you can internalize a new experience and begin to revise your beliefs about yourself, and build self-esteem, because shame will tear down your self-esteem, especially the self-talk, like there's something wrong with me. I'm not good enough. Why does this keep happening? Why won't he stop? Why won't she stop? So, it might include or require revisiting some shame-inducing events of the past, and reevaluating them from a new perspective. So it really takes an empathetic therapist or counselor to create that space so that you can incrementally tolerate self-loathing and the pain of shame enough to self-reflect upon it until it dissipates. So there is some work that's involved, but it's a heck of a lot. Whoops, I said hell of a lot more comfortable place.
That's okay. That's okay.
Than being in that painful place of shame, and Di talked about, we try to escape with different things and get hyper focused on other things besides the white elephant in the room of the addiction and how it's affecting the family by becoming a perfectionist, by becoming a people pleaser, getting focused on these things that are, in a way, an escape from the reality of what is going on. So, you know,
Yeah. And while
people
that's
people like
happening, if
ourselves understand how to deal with shame and addiction recovery, and we can support you, in your recovery from that.
of
But
course,
it is, yeah, it's an interesting topic, Diane. You brought it, and it's it's the guilt, the shame, the codependency. It all just piggybacks off each other, and you put labels on it, but at the end of the day, what does it end up being? It ends up being a dysfunctional, painful, unhappy place for everybody to be.
right. So suggestions as we do that, right? With the addict then needs to go do some recovery work, right? Probably needs a little bit of treatment to, disconnect, and we need time and space, as we always say, to get started. And the family members, they need time and space from them, and they need their beginnings and learning how to step by step by step learn how to pull away from their own shame in this whole scenario. It's really interesting how deeply intertwined, everybody is. Everybody always thinks it's one side or the other, and I'm like, no, they are extremely interconnected, and it must be looked at as a group effort, right? I mean, one can get better without the other for sure, but when we can get both sides together, we do a much more effective job, don't you think, B? When we can
Oh
get
yeah,
both sides
yeah. As
together.
we've said in the past, the family members most of the time get sicker than the person that's in active
Right.
addiction. So, is it, we sit around as a family waiting for this person to get well, and our happiness is contingent on that. Where in the meantime, there's something that we could be doing for ourselves as family members so that we can overcome the way we feel, which is sometimes, as I said earlier, just a lot worse than the person who is out there actively drinking or drugging. So,
100%. So give us a shout on info at familyandaddictionexperts.com. We'd love to hear from you with any questions or thoughts or concerns. And we actually have a resource page on there if you have any questions or some free info that you can get. We have an Instagram page, Facebook page. You're welcome to, take a look at that and have some good insight into things from day to day. We also have, a 30-minute free consult if somebody is interested in checking us out and seeing if we're a good fit for you. We'd love to meet you, answer any questions we could. If you or your loved one is suffering, we'd love to get together with you and meet you. So for now, we'd like to, the one takeaway from today is, we never want someone to get to the place of shame. Shame is a really, really tough one. And there's so many people that spend so much time living in shame. That's not the goal. Lots of good solutions. We gave you a very, very brief synopsis of what shame looks like within both the family system and just how the guilt shame cycle, affects both sides of that. But we'd like you to try to reach out and get some help if at all possible.
yeah. And so if you do want a free consult, go to www.familyandaddictionexperts.com, and you can click on free consult, and we can schedule a time to meet with you. And Di, again, great to be with you. Great topic. I would like to take credit for it, but you brought the topic.
Oh boy, that's all right. We'll look forward to it. You bring up lots of good ones yourself there, B. So, all right. Until the next time, I'm Di McQueen with Dr. Brian Jackson, and we are healing families shattered by addiction. Take care now.
Bye-bye. Bye. Bye, Di.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.